Atrial fibrillation is a cardiac arrhythmia that increases your risk of stroke by 5-fold. And these strokes tend to be more disabling compared to strokes from other subtypes. Crucially, AF-related stroke is entirely preventable if the appropriate patients are started on anticoagulation treatment. Frustratingly, a lot of patients who have atrial fibrillation don't know that they have it, and the first manifestation of undiagnosed atrial fibrillation is at the time of their stroke. We set up the stroke prevention service at Addenbrookes Hospital to tackle this problem. Every single patient coming in under the general medical take are screened for atrial fibrillation using their 12-lead ECG. We look at their medical records and assess their risk of stroke and implement appropriate stroke prevention strategies. We're very fortunate to be supported by the AHSN in initially setting up the service, but also developing it into what it is now.
We've been delighted to support the stroke prevention service at Addenbrookes Hospital through the AHSN Network's partnership with industry. We've also been able to support them with some new digital technologies as well as mobile ECG devices to help improve the service.
On a daily basis, we screen all the patients who are medically admitted to the hospital. We look at mostly their ECGs is the first port of call for us, medical history, and whether they're taking oral anticoagulation already or not.
Once we have our patient list for the day, we work through each case. We look at their arrhythmia history, we look at their past medical history, looking for things that may cause problems in terms of anticoagulation. We also look at blood results, and we look for other medications that may be contraindicated in anticoagulation. Once we've formulated our story, we may need to involve other specialities, and we may need to discuss the individual cases with our stroke physicians also. Essentially what we're doing is looking to ensure that the benefits of anticoagulation outweigh the risks.
So then following on from our holistic assessment, if we deem the patient is appropriate for the anticoagulation, we'll discuss it openly, giving the patients all the facts and the knowledge to make an informed decision.
We also accept outpatient referrals, so we will discuss cases with the GP. We may get referrals from the cardiac technicians who do pacemakers, Holter monitors, ECGs and echocardiograms. They refer to us and we treat those in exactly the same way, risk stratifying them, and we will usually bring those patients into an outpatient clinic.
Once we've deemed that the patient is appropriate for anticoagulation, we'll talk to the patient one-to-one and we'll discuss the risks and benefits of taking the medication. And quite often these patients could be quite elderly, so we will always encourage involvement with the family and awareness of what's being discussed and being considered.
I'm now 72 years of age and I've had atrial fibrillation for getting on 20 years. It's become more serious recently, which was why I was recommended to go to the stroke prevention clinic at Addenbrookes. The lead nurse took control of the whole procedure. He managed to arrange original appointments to suit ourselves. The consultation process was lengthy, comprehensive, pleasant, it was easy, and most important for people like me, I guess, it was very much explained in lay terms and gave me all the information I needed to make the best decision for myself. Post-consultation, the follow-up by the charge nurse again to make sure everything was okay and he'd covered everything, and by another member of the team to make sure that my prescription had arrived and that medication was in order. All in all, the whole process, on reflection, was painless and worked for me. I would have no hesitation in recommending this service.
In the first year, the service has screened 15,000 general medical admissions and identified 400 new cases of atrial fibrillation. We estimate to have prevented 16 strokes and 8 deaths in our first year alone. Screening is done using a 12-lead ECG, which every general medical admission patient has routinely. So this is a cost-effective way of screening for atrial fibrillation in a high-risk secondary care population.
Stroke Prevention Service has had great success in its first year, receiving national recognition through the AF Pioneers Award. This is the kind of innovation that we'd love to see spread across the country, so if you'd like some further information, please don't hesitate to get in touch.